So welcome back to the 2022 Planetary Health Annual Meeting at Harvard University. I hope you all had a great lunch. You're feeling rejuvenated and ready for this next session. We have an exciting, fast-paced round of lightning talks, followed by a discussion. We're going to have 6 speakers up here presenting their research in 3-minute increments. And then afterwards, we're going to have a discussion panel Q&A, similar to what we've done before. So if you could please step up to the mic after the last presenter finishes their lightning talk. And we'll have about 30 minutes to do this. Our presenters are going to be in the following order. We have Yusuf Jameel, and I apologize in advance if I mispronounce any of these. Elaine Flores, Michail Georgiou, Matt Smith, Semíramis Martins Álvares Domene, and Thais De Ruyter. And Yusuf will be virtual.
All set, Kent?
All set.
Thanks. Thank you, everyone, for joining today. The title of my presentation is Climate Poverty Connections, an evidence-based review of climate solutions that generate human well-being co-benefits. In Africa and South Asia, climate change and poverty are the defining challenges of our time. Climate change is dramatically impacting these regions, even though they have contributed less than 10% of the cumulative greenhouse gas emissions. Despite the fact that worldwide, over 1.3 billion people have emerged from extreme poverty in the past 25 years, 400 million people in sub-Saharan Africa still live on less than $1.90 a day. Climate change threatens decades of progress and intensifies pre-existing inequalities. It especially harms women and children and amplifies gender inequality. These challenges, along with climate magnified disasters like the recent flooding in Pakistan, threatens the lives and livelihoods of millions. But solutions are at hand. If we address poverty and climate change simultaneously and synergistically, we can reduce the impact of climate change and contribute to socio-economic development. After reviewing more than 400 articles, Project Drawdown identified 28 climate solutions that also substantially help alleviate poverty and enhance multiple aspects of well-being. This solution focuses on improving agriculture and agroforestry, protecting and restoring ecosystems, providing clean cooking, providing clean electricity, and fostering equality. For example, growing trees and annual crop together, a powerful climate solution can boost income and food and water security and provide benefits for education, health, gender equality, and energy. So how can we use this knowledge to address the dual climate and poverty crises together? We have a small window of opportunity to harmonize policies and align funding to ensure a brighter future for the people and the planet. Policymakers in low and middle income countries can simultaneously achieve low carbon economic growth and accelerate progress towards reaching their SDGs by prioritizing these climate solutions in their national climate plans. In low and middle income countries, climate finance institutions, philanthropists, business and investors can prioritize strategies that boost well-being and mitigate climate change. They can also advocate for fulfilling funding commitments to meet the rising adaptation and mitigation cost and ensure that climate finance is additive to the existing official development assistance programs. Yet climate investment is several times lower than what is needed. Climate change and poverty are urgent problems. To solve them, policymakers and decision makers must consult and collaborate with local communities, indigenous people, women, and youth. By taking actions to address climate change and poverty together today will shape the well-being of millions of the people for generations to come. Please visit my poster and Project Drawdown to know more about the climate poverty connections. Thank you so much.
Thank you, Yusuf. Thank you, Yusuf. Elaine?
Are you able to hear me? Okay, thank you. Well, first, thank you so much for the opportunity. I will just summarize the findings that we had on a qualitative study conducted in Peru. As a Peruvian physician, I was particularly motivated to conduct this exploration, and I hope that I can highlight you what we learned. Next one, please. So we know that climate change is undermining our health foundations. However, the heterogeneous distribution of social inequities and specific vulnerabilities result in very different impacts. Women living in low and middle income countries, such as Peru, are disproportionately impacted. And this will be worse for those who are impoverished, indigenous, or who live in rural areas. There is a growing research interest on the role of environmental effects on human mental health worldwide. However, Peruvian data is particularly scarce. In this context, we aim to gain a better understanding of the women's awareness and experiences on climatic change effects and environmental threats, and also describe on an individual and community level their needs, risks, and potential agents for transformative action. Next one, please. So this qualitative study conducted 48 semi-structured individual walk-in interviews with adult women across 6 different ethnic groups and 15 communities. We identified and selected key community informants, and all the interviews were conducted in Spanish, but also follow the cues of the interviewings on the routes, pace, or break times. And we also triangulated it with geolocation mapping and photography of the environmental hazards reported. We use also a collaborative framework for analysis, including local research assistance in each region for capacity building options. Next one, please. So we arrived with a really complex scenario. Participants' age ranged between 20 and 68 years, resided in peri-urban, semi-rural areas. Most had completed secondary education or had incomplete tertiary education. And the majority hold very different roles, not only for occupation levels and incomes, but also voluntary roles across their communities. What was concerning was that several of them mentioned a lack of awareness of the causes, roles, and drivers of climate change, despite being clearly able to identify the effects and their detrimental role in their own lives and livelihoods in their communities. Weak institutions, multi-level corruption, and the absence of competent authorities were identified as barriers. Next one, please. We definitely found and reported feelings, negative feelings related to distrust, powerlessness, and also macrostructural barriers. By contrast, some interviewees highlighted that some women empowerment work and building of trust had already been done, and there were some good examples across local organizations. However, that was often overshadowed by their male counterparts. Next one, please. So actually, what our findings want to highlight are the multiple and interrelated issues faced by environmentally threatened communities in Peru, and how clear macrostructural barriers contribute to the lack of awareness on direct hazards, disempowerment, and feelings of suffering across women. We know that women are key to improving environmental conditions, so they need to be represented. And also, we need multi-layer and multifaceted approaches to develop strategies and services, both to promote and protect mental health and well-being needs. Next one, please. And finally, I just want to highlight that we now have an opportunity to address these impacts and reach a much-needed transformative action. Thank you so much for your attention.
Thank you, Elaine. Next, we have Michail.
Okay, so hi everyone, I'm Michail Georgiou, and I'm part of the Glasgow University Green and Blue Space Wellbeing Research Group. So today I'm going to talk to you about our work on investigating whether blue space modifies the negative effects of socio-economic deprivation and mental health in urban areas. So To begin with, blue spaces describe all inland waterways and water bodies, which means canals, rivers, ponds, lakes, and so on. So in this study, we decided to focus on mental health, but one of the main determinants of mental health is socioeconomic deprivation. So trying to integrate this in our study, this is what we finally decided to investigate. What is the impact of blue space on mental health when socioeconomic deprivation comes into play? And this is an important question because if, for instance, we found that blue space alleviates the negative effects of socioeconomic deprivation on mental health, then we would be able to focus blue space regeneration efforts to the most deprived areas of our cities and therefore improve health equality. So we conducted a study in the north of Glasgow branch of the Forth and Clyde Canal in Glasgow here in Scotland. And the Forth and Clyde Canal crosses central Scotland for 56 kilometers. It was closed in 1963 and experienced complete dereliction and essentially became a dumping ground. And the canal has now been under regeneration since the early 2000s, and today it serves as an area of recreation. The north of Glasgow area of the canal is surrounded by some of the most deprived areas in the city, and the area is characterized by a cluster of socioeconomic deprivation and mental health vulnerabilities. But it's also a unique natural experiment for scientific studies. Now, this was a population-based retrospective cohort study using routinely collected primary care data from the Scottish National Health Service of 2 million people over a 10-year period between 2009 and 2018. And essentially, we developed two Cox proportional hazard models, and we conducted a survival analysis. And then we compared effects between the two models, and we did find some interesting results. So among other effects, our analysis showed that people in the most socioeconomically deprived tertile had a 154% higher risk of developing mental health disorders than those in the least deprived tertile. Those living in the medium deprivation tertile had a 70% higher risk than those in the least deprived tertile again. Now, regarding the modifying effect of blue space, living near blue space modified the higher risk of socioeconomic deprivation by 6% for those in the most deprived tertile and by 4% for those in the medium deprivation tertile. So to sum up, living near blue space can alleviate the effects of socioeconomic deprivation on mental health, and regeneration of blue spaces could be a powerful tool to reduce mental health inequalities. But we think that most importantly, this study is a call for blue space regeneration efforts to focus on the most deprived areas of our cities. And finally, this is a published paper on Nature Scientific Reports, so feel free to scan the QR code if you'd like to have a read. Thank you very much.
Thank you, Michail. Matt, please.
Is there a clicker on? Oh, great. Great. Hi, everyone. So I'm going to talk about some of the research that me and the group that I work with have done looking at pollinators in particular and looking at the effect that having too few pollinators is having right now on global food supplies and on human health. So by way of background, I'm going to make 2 points at the start. So one is that animal pollinators are key contributors to our food system. And though they might not be a main contributor in the way that you might think, which is in caloric supplies, they don't actually pollinate some of the big caloric sources in the diet, like grains or starchy vegetables, but they do pollinate some of the healthiest foods, like fruits and vegetables and nuts. And all of these foods have a protective effect against a wide range of chronic diseases that are main sources of mortality and morbidity, like heart disease, stroke, cancer, and diabetes. The second point is that pollinators are in peril around the world. So there are declines in most species in either occurrence, diversity, range, or abundance when they're measured. And the causes of this are many-fold. So there is land use change that is removing areas that are suitable for nesting, also fragmenting the habitat so they can't move around very easily to adapt. There's intensive agricultural management, which is such as increased tilling, which affects ground nesting bees. There's heavy pesticide use, which has lethal and sublethal effects. There's pollution, nutritional stress due to a lack of forage, invasive species, pathogens, climate change. All of these have an effect. And unless addressed, all of these drivers are expected to persist or accelerate. And studies have shown that an inadequate pollination is already suppressing the crop yields in most cropping systems around the world. So the question we wanted to answer is, what are the food and health benefits that we're missing by having too few pollinators? What penalty are we paying right now for that? So in order to do that, we took 5 steps. One is to look at the world and try to understand what are total yield gaps of pollinated foods. What's the difference between what people are growing and what they could theoretically grow based on their climate? Then we used a robust global empirical data set to understand what percentage of the total yield gap is attributable to having too little pollination. Then we theoretically closed that gap to estimate how much more food could be produced if we had enough pollinators, enough and diverse pollinators. And then we put that into a global economic and trade model to understand where that food would ultimately be eaten if it were traded around the world. And then we translated that using human epidemiological studies into rates of chronic disease. And this was done with an amazing interdisciplinary team. Each step along this chain was run by a different expert in this field. And what we found was that if we had sufficient and diverse pollinators, we would produce 3 to 5% more fruits, vegetables, and nuts. In other words, we're currently eating 3 to 5% less fruits, vegetables, and nuts than we could be otherwise, which contributes to 400,000 excess deaths annually due to that lost food. And this is not only a food story, but it's also an economic story, especially in low and lower middle income countries. These foods are very valuable to their economies. And we looked at 3 case studies and found that between 12 and 31% of total economic value of agriculture is being lost because of that lost pollinated food. So in summary, pollinators support the production of key healthy foods that protect against major causes of death. Currently, our current population of wild pollinators is insufficient and causing 3 to 5% losses of healthy foods per year and causing 400,000 deaths. And these trends are likely to worsen over time without serious intervention. All right, thank you.
Thank you, Matt. And next we have Semíramis.
Hi, everyone. I'm not sure if you are listening to me.
Yep.
Is that okay? So thank you. It's a great opportunity to interact with all those fabulous experiences and to present some of our data on the participation of native foods from Brazilian biomes in the National School Feeding Program, which is a huge program that carries out institutional purchases of food in the country. The federal government has invested almost $769 million in public resources in school meals in 2022. And as biodiversity is a concern, for most of us, it's important not only to work for regenerative food systems, but also to increase the viability of nutrients and bioactive compounds in the diet with health and environmental benefits for all of us. So Brazil has the greatest biodiversity in the planet with almost 20% of all species. And however, adapted exotic species account for most of the fruits and vegetables consumed internally. Among the 10 most consumed fruits, for example, only 2 are native. Therefore, this study aims to identify the native species and their products in the National School Feeding Program. And we are investigating data from a public database of invoices that are available in the accounting management system of the National Fund for the Development of Education. And we considered all the invoices from 1920 by 26 municipalities, 1 in each of the states of the Federation, and covering all our 6 national biomes. And we are identified native species and their products on a list of 94 social biodiversity foods. only 9 items from the list of native species were found in this study. The most common native species product purchased were cassava and cassava flour, and also urucum, that's a condiment, and guava. None of the vegetables, and only 5 types of fruits such as guava, pineapple, passion fruit, cashew, and acai from the 94 list of native species were available for school meals. So, of the total purchases in all municipalities, almost 3,000, only 175 were from native products. The majority in municipalities located in Caatinga and Atlantic forests, and some in the Amazon. So to sum up, regulated public policies can contribute to strengthening of local production of native species, but the preservation of biodiversity in Brazil faces obstacles arising from the decrease in investments in research and the loss of native vegetation. Only 18.6% of the Brazilian biomes are still protected. The Cerrado, for example, a biome that occupies 25% of the entire Brazilian territory, has already lost 46% of its area due to unsustainable anthropic activity. So as you can see, the inclusion of products from native biodiversity is low in official purchases from school meals in Brazil. So there's room to increase the participation of Brazilian social biodiversity ingredients in school meals, which can have positive impacts on health and environment. It has already been shown that public purchases are important to protect the activity of family farmers, which strengthens the local economy. And Brazil, as a signatory of the Sustainable Development Goals, can also contribute to commitments through public policy procurement. So that's it. Thank you for your attention.
Thank you. And last but not least, we have Thais.
Good afternoon, everyone. My name is Thais De Ruyter. I am a PhD student from Belgium, affiliated with Ghent University and Hasselt University. And I am very happy that I got the opportunity today to share the results of my latest research, which is called Residential Green Space and Waste Circumference Impact Telomere Dynamics in Childhood. So first, I'll start with some background. Telomeres are the protective end caps of our chromosomes. They protect our DNA from degradation. And you might think, well, why are you interested in these telomeres? Well, that is because telomere length is a biomarker for biological aging and is also considered as a risk factor for several age-related diseases. Each cell division, our telomeres shorten, which we call telomere attrition. And lifestyle and environmental exposures can have an influence on telomere attrition. And that is also why the objective of this study was to explore the associations between lifestyle, environmental exposures, and longitudinal telomere change in childhood. On the figure, you can also see the exposures that were considered in this study. On the next slide, you can see an overview of the methods that we used in this study. I will go over it clockwise. So we used the CHIPS cohort, which is a children cohort consisting of 150 children that were aged 3 to 10 years old at baseline. And they were followed up for 5 till 7 years. We collected blood samples from the children from which we could measure the average relative telomere length using a qPCR method. And the children also filled in questionnaires and were examined with physical examinations to get more insights into their exposures at baseline. And last but not least, we performed linear regression analysis to get more insight into the data. Now, the results on this figure, you can see on the y-axis the significance of the results, and on the x-axis you can see the effect. So we have on your left side more telomere attrition, and on the right side less telomere attrition. And then we can see that we have two significant results. First, we have waist circumference. A higher waist circumference at baseline is associated with more telomere attrition and thus with faster biological aging. And on the other side, we have residential green space. More residential green space was associated with less telomere attrition and thus with a slower biological aging. So to conclude my research, we saw that residential green space is associated with slower telomere attrition and thus with slower biological aging. And we also found that vegetation higher than 3 meters was the dominant factor in this association. And lastly, we saw that waist circumference was associated with a faster telomere attrition and thus with faster biological aging. I would like to thank you for listening, and if you have any questions, please feel free to contact me or to reach out to me in the poster session this evening. Thank you.
Can we get one more round of applause for all of our scholars here who just presented months of research in 3 minutes' time, just to acknowledge that fact. So now, like I said, this is the discussion portion of the presentation. Please step up to the mics like we've done in previous presentations. Ask questions, make comments. The floor is yours. And can we bring up the 3 virtual attendees as well?
Hi, Matt. I'd like to know what kind of data do you use to get to those results in terms of the effect of the loss of pollinators?
Oh.
What kind of data?
What kind of data?
Yeah.
Lots of to understand the pollinator-specific part or the whole chain, because there were lots of data sources that went into it.
Yeah, I said a lot of yeah.
Well, to understand the yield gaps, I think there was global data sets of sort of gridded yields around the world for 63 different pollinated crops, and then to understand the proportion of that was attributable to pollinators, there was this global empirical data set that was put together by our colleague Lucas Garibaldi, where he went to a bunch of experimental farms on, I think, 4 different continents, looking at, I forget the number of crops, but it was in the 20s or 30s of different crops, trying to understand, and he took a bunch of different characteristics of the farms and of the environmental conditions to isolate the role of pollinators in yields. And we were able to combine those two. And then in the global economic model, there was all kinds of variables that went into that, but the impact model is the one we use, which is a huge global model trying to understand how people trade with each other, how people respond to those price incentives, and how that flows through the global system.
Okay, thank you. So I understand that that's a paper in preparation, right?
Yes. Lots of different
Eager
pieces.
to learn about that. Thank you.
So I have a couple of questions. Sam Myers, Director of Planetary Health Alliance. From Michail, so you found that blue space in lower socioeconomic neighborhoods seemed to improve sort of mental health outcomes, it sounded like, by about 6%, I think was what you said. How does that compare to other literature? Have there been other studies about blue space exposure and its impacts? And also, how does that compare to green space studies? Sort of, can you contextualize those results for us?
Yes, right. So in terms of other studies on blue spaces and mental health, this is quite small because I've seen other studies stating, pretty similar, but larger effects, like 10 to 15%, for instance. But this is, probably the first study, or well, to my knowledge at least, that quantifies this effect that comes through the pathway of socio-economic deprivation. And although this is a small effect, like 6% for those in the most deprived areas and 4% for those in the medium deprivation areas, if we think about it in absolute numbers, these percentages can be game-changing, especially if blue space regeneration efforts were adopted like countrywide. And also one thing I'd like to mention is that this is just one of the co-benefits of blue space. So for instance, last year we published another study, and we found that living near blue space within 700 meters from the same canal also lowers the risk of developing several chronic health conditions. So there's quite a lot of research to do in this, but these are just some of the co-benefits. Yeah, that's my answer.
Hello, my question goes to Matthew. Thank you very much. I wanted to find out, as you're looking at the deficits in the food production, do you think it would be interesting to find out the specific nutrients that the food deficits produce, and then link the nutrient gaps to possible nutrition outcomes? Would that be possible, and would it tell us something in terms of where to intervene to make up for those deficits so that we provide the specific nutrients? My name is Esther from the International Livestock Research Institute in Nairobi, Kenya, and a PhD student at Wageningen in Netherlands. Thanks.
Yeah, that's a great question. And we did not apply, or we did not look at the nutritional components of the foods that are being lost. And in this study, there was an earlier study that we published a few years ago in the Lancet that looked at both looking at theoretical losses of pollinators, and if we said, okay, if we lost all of the pollinators on Earth, what would be the outcome? And we compared both chronic diseases and nutritional deficiencies for the nutrients that would be supplied by these pollinated foods. So we looked specifically at vitamin A and folate in that case. And we found that the effect was almost entirely chronic disease. There was very little malnutrition-related disease that was associated with pollinator loss. So that's why we decided to focus on chronic disease as part of this study. But that's a very good question, though, because a lot of these fruits and vegetables are major contributors to some specific nutrients in the diet.
I have a question for all of you. I'm Carlos Fire, I'm the Associate Director of the Planetary Health Alliance. Just feel free to, whoever wants to answer this. I mean, I hope that if you're here, you feel that you're part of this planetary health family community. So I was wondering, a lot has been talked about storytelling and how do we change the narrative, how do we express our research into kind of this broader understanding of what is planetary health. And of course, you're all doing amazing research in kind of niche research areas. So how do you all translate your research story into the larger story of planetary health and the larger narrative? So a question for whoever wants to take that. Thank you.
Well, I think that I will just give it a go, but what you mentioned is really important. I think that one of the main critiques that we have been receiving also from the academic side is exactly that we work in silos. We need to bring more interdisciplinary sciences and bring people with lived experience and communities back to we need to highlight their voices. And it's true that some of us will be working towards considering climate change effects as a health. I think that a health crisis, a public health crisis, and we definitely need to be working towards the other disciplines and trying to bring not only storytelling, but also more creative and non-verbal type of expressions in the methods that we use. No? Not only the data, but also bringing back what we can relate. But it's a really important issue that we need to figure out how best can we shift this and bring back the movement. I mean, we are all aware that time is ticking and that we need to accelerate the response, collective action. Thank you.
I'll also add, from my work, there's kind of, pollinators are an interesting topic because they're sort of the fulcrum of, there's so many factors that are going into the losses of pollinators. It's a climate change story, it's an environmental degradation story, it's, you know, pesticide use. And they all kind of converge in the losses of pollinators, and then it sort of branches out from there. Then it becomes a food system story, it becomes an economic story, it becomes a nutrition health story. So it's, and all in the package of, you know, kind of a charismatic, I mean, to me, maybe, I'm biased, but that pollinators are, you know, they're everywhere, people see them, they understand them, and so it's somewhat of an easy story to tell because it combines all of these environmental factors in one and branches out into all these different ways that it can affect people.
Yusuf?
Yeah, I would like to just add a couple of points. So that was a great question, and I think when we think about the people and the planet, you know, it can only be improved or addressed, all the challenges we are facing today, if we collaborate, if we work together. And at Project Ground, this is our motto. You know, we have several groups you can call, and you know, we have a storytelling group that work with local communities right now within the US itself, but hopefully we'll expand to different countries in future. We have a labs group that work with businesses, you know, trying to align their business with climate actions. Similarly, at LIFT, we publish report and we work with multinational developmental banks, as well as local policy makers and decision makers to really, you know, translate this knowledge that's out there into some kind of actionable items that can be achieved on the ground. And, you know, and we as an organization, we really believe that this, you know, the challenge we are facing today can only be addressed when we work together, and we are trying to do it as much as we can, you know, in our work. So, yeah.
Go ahead, Michail.
Yeah, so that's a very good question. So I think it's all a matter of relating and feeling the effects that the study presents. At least that's my opinion. So for blue spaces, for instance, I think it's all a matter of communicating the results in the most simplistic way, like avoid any scientific language, any you know, terminology that is well, difficult to understand to someone who's not in the field. And also it's all a matter of getting people out there to just, you know, enjoy the canals and see that these can actually have a significant benefit on their personal life.
Yeah, hi, my question's for Elaine. My name is Jules. I'm from Glasgow Caledonian University. Great work, great research. In your recommendations, you mentioned about the implementation of the need for multi-layered, multifaceted approach to improve the mental health and well-being of the women that you've interviewed. Can you talk more about like the specifics of this multi-layered and multifaceted approach that these women would need to improve their health and well-being?
Thank you. One of the things that actually struck us and motivated us to interview these women was about how they were doing on the day-to-day basis adaptive strategies, you know, without receiving much support or without receiving recognition or, you know, building I don't know, like trusts with authorities and other institutions. So what we talked with them was about how will it best address their needs, not only to protect their well-being and also the mental health and because they were also aware that they were living in high-risk areas, that they had very little power to make changes. So one of the things that we are actually developing now and trying to design an intervention will be addressing these two levels. No? One, at the individual level, their intrinsic vulnerability factors, the assets and needs and agency that they may have at their local communities, and also trying to work at the structural barriers that they are having, no? Trying to build some bridges with authorities, with healthcare providers, because one of the areas actually was really clear that they distrust healthcare providers as well. So it would be not only to build empowerment especially for women in terms of agents of change, because they are already doing a lot of work, but also trying to build up what it can be done at a community level, but also trying to do a change in society as well. So it's a bit of ambitious, but trying to work at two levels at least. Thank you.
Yeah, hi, I'm Henrique, and I'm a family doctor, and I was very interested in the telomere research, yes, because if I tell my patients that living closer to green areas, their DNA will be protected, it communicates very well, at least to my patients. So do you have other literature to support this, or how innovative was this? And it seemed like there was a mirror image with a waste effect. So would that be like a confounding, what is cause and effect? Does green space have an independent effect, or is it through you have more space to exercise? Yeah.
Thank you for this question, very interesting question. So first, we have to put things a little bit in perspective. So we could show an association between higher green space and less telomere attrition, but we were not able to find a causal link between the two. So we found the association. And then to go further on the next part of your question, indeed, they were a little bit in a mirror on the figure. And we also thought about, well, how do these two exposures correlate with each other, and how can we see this? So to explore this further, we performed a mediation analysis, and we saw that the effect of green space was partially mediated by waist circumference, which could make us think that people that are living in greener spaces might have more physical activity, which could, for example, reduce their waist circumference and then have a combined effect on the DNA or on the telomeres. So the mediation was partially, I think there was a mediation of 16%. So to answer your question, yes, 16%. So not very big. Yes.
Thank you very much. My name is Irene Kimani. I work with the Food and Agriculture Organization in the Kenya office. And my question goes to Matthew Smith. I think that was a very good, pleasant presentation. It's actually a very interesting topic for me as an individual and as FAO as an organization. And I would like to request you to comment on the tricky balance between addressing a crisis such as desert locust invasion through pesticides, of course, application, which has we know the desert locust invasion has an impact on acute food insecurity – versus preserving pollinators to prevent chronic food insecurity.
I understand most of it, I thought, but I think a little quiet. So were you trying to say that there was a balance between preserving food security from preserving pollinators versus pesticide use? Was that?
Let me try and repeat the question.
Could you turn
maybe a little closer to
the mic up a little
I project?
bit? Or that too. Just turn the mic up a little bit, or like angle it. All right, that works.
Okay. Can you hear me now?
Yes.
Sorry. So what is your comment on the tricky balance between addressing a crisis such as desert locust invasion through pesticide application? Of course, desert locust invasion has had a huge impact on the Horn of Africa in terms of acute food insecurity, and the tricky balance between that and preserving pollinators to prevent chronic food insecurity.
Yeah.
Clear?
Yes, now, got it. Thank you. Great question. And I haven't thought of it before, but I mean, that's a good question. I'm trying to, I feel a little stumped. I mean, I would, because desert locust infestations are such, from what I understand, such kind of cataclysmic, sudden events, the use of sort of emergency applications of pesticide to protect against desert locusts feels like a necessary use of those. And also, I think the types of pesticides that tend to be most lethal to bees are not, I mean, they're at least the neonicotinoid species, and I don't know if those are the same types that you would apply in a desert locust situation. So it's a good question. I've got to think more about it. I apologize.
Thank you. That's also something we've been struggling with. Thank you.
Yes, my name is Beatrice Kiage. I'm from Jomo Kenyatta University in Kenya. And I was just asking a question about the presenter who presented on the blue space effect on the mental health status of women. First, I'd like to ask why did you choose women? Did you think that also men will also be, isn't mental health also an issue for men? And then also, it would be interesting to know whether there was an aggregation of the age groups, because I'm imagining the issues that younger women will deal with will be different from the older women. So it would be important for me to get to hear whether there was anything like that. It would be of interest to me. Thank you.
I guess the question is for me, right?
Yes.
Yes, cool. We had both men and women in our sample, so we didn't choose like a particular group. You probably saw one of the results that said that women were most affected by mental health. Is that right?
I thought I just had women, so I was very concerned whether the men were not also included, and I would like to know whether there was any age segregation so that we're able to know whether was it more effective for the older women, the younger women, so that you can come up with more, like recommendations for the different age categories. Thank you.
Yeah, that's a very good question and idea. We did not do that. We did not look into that. But no, we had both men and women in the sample. Sorry about that.
I have one quick, well, maybe not that quick follow-up question related to Carlos's question about how this sort of fits in the larger context of planetary health, because I think it's so exciting to hear what all 5 of you are doing, and each one of you has added a new story to the planetary health sort of universe, and it's a very granular, compelling story about how some very specific kind of environmental change or exposure affects some very specific health outcome. And I'm curious, you're all sort of early career, mid-career scientists, how much encouragement have you had to tell these stories to the popular press, to think about writing an op-ed in your local newspaper, to share your story with a Rotary Club or a local church or temple, to bring this out of academia, because what we're all talking about in this planetary health community is the need for societal transformation. If these stories stay in the academic world, we won't achieve that. And so do you see your roles as scientists also telling this story out to a broader audience? And if so, how have you thought about doing that?
Yes, I think definitely that's also very important to go out to the broader public. And I can speak for myself, but I think the others too. I try to do that as much as possible. So today it's more an academic conference. However, in Belgium, I try to go out in public and tell my story. For example, in a few weeks, there's this Science Day. I don't know if you have it too in America. And I will have a talk about my research, but addressed especially for young children. So to make my research comprehensible for everyone. And I think such kind of activities are very important to get everyone to know what are the problems, the challenges, and to make people aware of the problems that we are facing. So I agree that it's very important.
Semíramis?
Yes, thank you. I apologize for the problem with my camera. I'm not sure what happened, but I'm happy to be here with you. And I would appreciate to talk a little bit about this question. It's a very interesting question. And we also have initiatives here in Brazil to bring the knowledge to people, because we firmly believe that social control and social participation is essential, even to keep things working when a government and, some manager can change things. So the participation of the people are important, essential, and they are, of course, the main objective of everything that we have done. So I appreciate the question, and I think this is a very important issue for us to strengthen with people through organizations and also through our own research groups.
Michail?
Yeah, so going out to the broader public, I think is even more important than actually doing the actual study. And well, in our case, I think we were quite lucky in this, because, well, mainstream media were very interested in learning more about this. But, well, maybe this also has to do with the fact that Scotland, as a country, is very supportive of blue space actions. They're planning to become a hydro nation, and they're looking for evidence to support these actions. So maybe one thing I'd like to say is that we also need to find the correct context where we share the results.
Hi, everyone. Thanks for the presentations. My question is open to anyone. I'm concerned about building resilience among, marginalized communities. So what do you think, based on your experiences, like working, with different communities, what do you think, how can we build, the resilience among marginalized communities who are, struggling with different types of, mental health issues? Because most of the time, resilience is, I feel like in the context of disaster risk reduction, it is being talked after a hazard happens, but I feel like it's something that needs to be done before we are hit by a hazard. So what do you think, how we can build resilience among the communities, especially the marginalized communities who are living in risk areas and who are struggling with poverty and other socioeconomic issues? Thank you.
So I will give a bit of my experience, because that is exactly one of the things that we have been concerned about. And usually you don't want to go to a community and try to, well, bring over a pilot or something that you do not know if that will be something that they consider it as necessary. So first, I think that, yeah, it is necessary to, well, to work with them, with the communities, through co-design, participatory methods, for them to be able to express how do they feel and what are their needs, in order to build agencies to help them and support them on an equal level. But the other thing is that what struck us more, and maybe going back to the study that we have done, is the lack of awareness and the lack of preparedness for even for cyclical phenomena and disasters that they had like a huge exposure. So I don't like that much the concept of resilience, but actually I really like in terms of how can we create empowered communities for them not only to change the hazards and be less exposed, but also to be able to, well, rebuild and recover for them and make actually a change in their lives, not to just be on the, let's say, the receiving side of the one disaster after the other, one exposure after the other. They need a change.
Yeah, I would like to add a couple of points, and that's a great question. And I think, you know, as climate change is becoming more intense, what we are seeing is that, you know, the people who are the most vulnerable, who have not contributed to climate change, are having or facing the worst impact. So there are multiple things that could be done, you know, but looking at the recent flooding events in Pakistan, in Nigeria, and the ongoing drought in the Horn of Africa, you know, one thing that's becoming really clear is that mitigation or adaptation might not be enough to help these communities. You know, you cannot adapt a house if you don't have a house. You cannot use a drought resilient crop if your land is dry or if your land is underwater, as we are seeing in case of Pakistan, that huge swaths of land are underwater right now. So for them, you know, loss and damage is something that's becoming very important. What they really need is to restart their life once again. You know, adaptation or mitigation is not going to help them. So for these communities that are living on the front lines and they are just one drought, one flood, one rainfall away from losing everything, every asset they have, we need a way to facilitate them to come out from these. You know, in short term, you know, we need to finance, you know, so that they can come back on their feet through loss and damage. In the long term, we need a development that is also adapted to the local climate. You know, first and foremost, I think education is very, very important, as we have seen through research from Bangladesh, from several sub-Saharan African countries, and from other South Asian countries. You know, families that are educated, they are more well prepared to adapt to any natural hazard that they see, especially girls and women's education. Secondly, you know, off-farm training. A lot of these communities, they rely on farming. If they have skill sets to use, you know, to deploy it somewhere else, they can manage to come out from, you know, a disaster that struck them more easily, or, you know, it could be easier for them. And finally, the most important thing is really fostering equality, you know, giving them hope, showing that the world stands with them. And I think these are really the core factors that can, in the short term, you know, help them come out, and in the long term build their resilience. So, you know, if you will ask me 2 or 3 key points, I'll say focus on education. Really, that's the key. Providing them skill sets. You know, in case of someone who has lost everything, you need a financial mechanism for 1 or 2 or 3 years to really get them back on their feet. These are the kind of solutions we are talking about. Otherwise, if we don't implement these as the time progresses, we'll see that all the gains that we have done in the developmental front, where more than 1 billion people have come out of poverty in the last 20, 30 years, we might lose all the achievements that the world has achieved. So, yeah.
Thank you. And Jeremy, in the essence of time, I think we only have time for one more question. Yep.
All right. Hello, everyone. My name is Emmanuel, and I'm proudly from Nigeria. And I'm a student of agriculture, so I was quite fascinated by what Matt said about pollinators. And looking at the planetary degradation story, it appears more to me like how man sadly bites the finger that feeds him. I'm talking of the earth, and how man pathetically kills the goose that lays the golden eggs. But to me, it appears more like a dilemma. Like we are kind of in a strait, and we have no choice because population keeps growing. We have to open more lands for agriculture. We have to inevitably curb pests that try to invade our farmlands. And so, but I think that the whole idea behind planetary health is to bring up solution-oriented approaches to these problems. So I'm kind of concerned because I'm particularly in agriculture and about pollinators. How do we really, what are these strategic approaches that you would prescribe to our government to, what policies do we have to adopt to make sure that we are at least conserving what we have, we are not destroying the pollinators we have right now, and at the same time, we are not, we are still meeting food demands, we are still making sure that society has enough food to eat healthy food. So what are the exact approaches that we have to adopt to make sure that we can do this? Thank you.
Sure, that's a great question. And there's quite a bit of consensus in at least the pollinator ecologist world about the things that, the strategies that are effective for preserving pollinators. And they're pretty common sense too. So they're, give them a place to live, don't poison them, and feed them. And so there are ways we can do that, pretty much all of those things that are able to balance the struggle that you outlined, that you laid out, which is that we do need agriculture, we do need new land to come online. But if we're able to set aside natural lands within agricultural lands, which is places where pollinators can nest, then they can be nearby a lot of the agricultural land they need. If you plant a lot of diverse floral resources, either along the edges of your farms, or if you're able to rotate crops on your farms, you're able to provide a diversity of floral resources, so they're able to feed throughout the year, as opposed to if you have one giant field that all blooms at once. Pollinators kind of don't have enough floral resources throughout the year. And then if you're able to come up with either pesticides that are less lethal for pollinators or other natural ways to control pests in a more sustainable agricultural sense, those are all ways that you can kind of continue, meet those demands, meet the rising food demands, while also not biting the finger, biting the hand that feeds you by killing pollinators, or at least depriving them of the things they need.
All right. Let's do another round of applause, please, for our scholars.